Hello, for our survey, we looked at the COVID-19 starting over. Hello, we're group two, and for our survey, we looked at COVID-19 and mental health amongst college students. Our official research question was, what is the relationship between COVID-19 and college students' mental health? In order to answer this question, we conducted a survey using Question Pro. The survey was not timed, so students had ample amount of time to take it, and it was open from February 11th to February 25th. The survey looked at things such as the COVID-19 exposure, and it asked students certain questions such as their history of mental illness and presence of suicidal ideations or feelings of loneliness over this past year. In total, we had 33 students who responded to the survey, but only 22 students actually completed the survey. The average age was 18 to 24 years old with a standard deviation of 0.359 years. Majority of our students were females, totaling in at 76.19%. We also asked students about the grade or level of college they were in, and we had 23.81% of students that said that they were in their senior year. So roughly 19% of our students were white. Roughly over 28% of our students reported being Hispanic or Latino. Over 33% of our students reported being Black or African American, and about 19% of students reported being mixed race or another race. So 28.5% of students surveyed that they have suicidal thoughts or had suicidal thoughts within the last year. Over half of the students reported that sometime in the last year they felt that they had suicidal thoughts, which was 57.14%, and about 38.10% of students reported that they had thoughts of suicide or feelings of loneliness quite frequently. And 4.76% of students deny having any sort of these feelings within the last year. So we did conduct a chi-square test to compare male to female safe social interaction. So 100% of our male participants stated that yes, they did feel that they would be able to have safe social interaction with their loved ones. However, for our females, 4.7% stated that no, they did not feel they would be able to have safe social interaction with their loved ones. We did a chi-squared analysis on this, and we got a p-value of 3.75, so it was not a significant finding for us. We cannot conclude that the COVID-19 pandemic had any effect on college students' mental health because we don't have the data to compare mental health before COVID-19 pandemic here at UTA, as well as we didn't have a very large sample size, so it wouldn't be adequate for us to conclude that the college students' mental health here at UTA was affected by the COVID-19 pandemic. So something that we can do to improve this survey would be to expand our sample size and compare the data before the COVID-19 pandemic. We did feel that we had a very clear data, and that was something that was a strength for us. However, moving forward, if we wanted to improve this survey, we would send out the survey to other colleges besides UTA to expand our sample size and to get a basis of college students from other areas and other experiences so that we can weed out potential errors from things that are just specific to UTA.